April 4 of 2007. We have Adriel Vasquez, and Adriel has a very large, that's the only report I have from the MRI right now, I didn't order the MRI, protruding left L5-S1 disc. If we look at his posture, it's kind of interesting because he's compensating in his posture, but we can see that his pelvis swings left. He does have some right lean to the lumbar that he begins to compensate. And can you take some steps forward, please? And this is his gait. Right now his gait, and you can turn around and come back, is terrible, and he's in a lot of pain, and he's in pain even when taking muscle relaxers and painkillers, Vicodin, etc. Adriel, just quickly, do I have your permission to share this information with doctors, students, and patients everywhere?
Yes, you do.
Any conditions on that?
No.
No conditions. Super. Regretfully, for the initial exam, we put Adriel in this sitting position, which increases lumbar pressure by 800%. And Mom, I'm going to hand you the camera. I want you to just focus on his foot. And kind of him, too. In fact, let me back that off as far as I can. How far can I get that? Not very. Stand right there. And focus on his foot for a moment. So there's our thing right there. But focus on his foot. Now, when I take his left foot, hold this and turn out, don't let me turn in, he's got some weakness here. And that's an indicator of our pressure. A secondary indicator, pull back against my hand, is going to be a weak biceps femoris. Now arch your back real hard. And the first thing we notice is that he hates that. And don't let me turn in. And hold up. There's no improvement in that foot. Now crunch your abdominals really hard, pulling your pubic bone to your sternum. Hold and don't let me pull. How much stronger is that right now?
A lot stronger.
A lot stronger. He's in pain when he says that. Now lie back on your back. Okay, we also found, and I'm doing this as we're, I did a pre-screening on him. Hold this, and don't let me pull this way. Hold your body real strong and don't let me move. And he's got nothing there, and he's very powerful. Now I'm going to have him hold his adrenal point right there. Hold that and don't let me pull. How much stronger is that?
A lot stronger.
That's a lot stronger if you can hear what he's saying. Now, what I'm going to have you do, I'm going to do a straight leg raise. And that hurts, yes?
Yes.
How bad does that hurt?
Very much so.
Very much. So we have almost no straight leg raise here at all. Now, for the fun of it, I'm going to stimulate this adrenal point. Hold pressure there. Lock. And now?
It's a lot better. That's where it hurts.
It's a lot better. We doubled the range of motion just with the adrenal point. Now, the same thing. Hold that point. Now, crunch your abdominals real hard. Pull your pubic bone to your sternum. You don't have to lift up your head. Crunch your pubic bone. Hold. That's good. That's about the same pain, yes? So we've tripled the range of motion. You can let that relax now. We've tripled the range of motion by crunching the abdominals and holding the adrenal point. These are very good signs. We can stop that for now. Record?
Yeah.
Okay. So I'm going to check this here. Notice he's okay with bending the leg. Hold this and don't let me turn outward. He can't get the leg up for one of the pelvis tests that I want, but I'm just going to push out against my hand. Push, 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 push. And by the way, his right quadratus lumborum was fine. Hold this up and out. Lock the knee. Don't let me push in. And hold this right here. Push outward. Okay. So I'm happy with that. Now, a very quick report of findings. So when people come in, they want to know the answers to 4 questions. 1, what's causing the problem? 2, can I help? 3, how long does it take to make a difference? 4, how much does everything cost? 5 other questions I like to answer. How complex is your case? 2, how strong and resilient are you? 3, are there underlying metabolic challenges, things in the way of the body healing itself? Not the purpose of this visit today, but I can tell you that this is a stress point. And so chronic distress is aggravating this problem. Pain creates chronic distress. We don't know what came first, the chicken or the egg. But we want to start breaking that pattern in at least 2 different ways. We're going to do it with nutrition and with reflex stimulation. 4, is there an unresolved trauma or infection is the 4th question. 5, is there anything else? So let me go through my 5. In terms of complexity, you've got a huge herniated disc as a young man. Believe it or not, it's better to have a huge herniated disc as a 70-year-old man than as a 25-year-old man. Because when you're 25, your discs are really hydrated. They're full of fluid, they're full of pressure. If I take a huge balloon and I pop it, it explodes. If I take a balloon which has a little bit of air and I pop it, it goes and you barely notice it. That's what it's like when a 70-year-old man herniates a disc. About the worst age you can herniate a disc. And we talked about back surgery and how It doesn't have a good track record, even though that's what they're recommending. Very few of my patients in 15 years, like 2 that I can think of, had back surgery. And there was other circumstances there, like bad bone spurs, and one guy's, he was just running out of insurance and he had to do something before his insurance ran out. Right. So, extenuating circumstances. So your case is complex just because it's a big bad disc. Now question 2, can I help? Well, my answer is always the same for every patient, no matter who in this circumstance, I don't know. Mm-hmm. But I do have a good track record. I expect you here and now today to make an immediate difference, but what I want to do is see you literally every day that I'm here until we have a negative straight leg raise. Now with a disc this big, it might take time. It might take 2 weeks. It might take 3 weeks. Once we get beyond that point, you're going to be so much happier. We may do it faster. It may take longer. If I'm guessing, I'm going to say 3 weeks is what my guess is. Okay. And I jumped. So complexity. Okay, strength and resilience. What you have that's working is working very well. Your muscles are strong. You're healthy for the most part. So we've got to tap into that. Underlying metabolic challenges, not what we're here for. Unresolved trauma, that's what this is. Something probably went wrong before this got set up in the first place. Okay, and then the final question, is there anything else? The sky's the limit. Your pain meds are masking your symptoms. And sometimes that's necessary. When you're in that much pain, that's all right. But they don't move your body towards a higher state of health. We ultimately want to move you towards a much higher state of health. So right now, what's causing the problem? You have muscle imbalance. You have nerve pressure caused by a big herniated disc. Can I help? I don't know. How long? I expect to make an instant difference. I'm anticipating 3 weeks daily, and then it should drop off very significantly. I've seen people come in worse than this, pain-free in a month, and never had a problem again, at least for as long as I know them. Costs, our initial workup is $75, follow-ups are $50. I'm going to give you some nutrients for the adrenal system. You know, we'll look at that. I think they're anywhere from $30 to $40, something like that. Okay? Questions for me?
So, just, I mean, pain, you say that you've dealt with worse symptoms before. Is it going to be something that I'm going to always have to come back and, you know, you're going to have to check up on me?
Yeah, that's always everybody's question.
All right.
It's not a bad idea for at least the first 6 months to be checking back on a regular basis.
Right.
And regular might be once every 3 weeks, it might be every month, it depends on your activity levels. Then after that, some type of intermittent follow-up is not a bad idea, but not required.
Okay, because, yeah, well, my activity level is high. Like I said, you know, I like to play a lot of sports, IE especially, though, more than not, just because it's easier to do, to play golf, and I mean, a lot of torquing on the back and stuff like that. Am I going to be able to get to a point, you think, in your honest opinion?
The other people I've worked with have.
Okay.
I blew out a huge disc in my low back in 1994. Different level. Mine was L4-5. Yours is a lateral distribution. Mine was medial, which makes it more complicated. Within 6 weeks, I was back in the gym, and I was playing softball better than I ever was before because I literally stretched every day and increased range of motion. I'll show you some stretches to do. But first, we got to get you out of pain.
Okay.
Okay. Other questions?
No, just, you know,
Okay,
I'm willing to work so to get it better. Don't worry about me not giving the effort.
Good. Well, then we're going to make
because I want to go back to exactly how I was, if not better than before. So.
Okay. Mom, I'm going to hit some reflex points for the camera that I pre-screened. The adrenal system is out of balance. So I'm going to hit this, and his psoas, I palpated the psoas on the right side, absolutely tight as a drum, as we'll show you that in a moment. Now I cannot do a psoas test on the right side. His body will not let me raise the leg. So we have a little problem with that. So I'm going to make some assumptions. I'm going to do, and I'll teach this in my lumbar course, a strain counter strain on the psoas. And I'm going to do an occiput traction. Literally, I could test the other side just to see if it's there. But, you know, the right side doesn't necessarily give us the left. I'm going to balance the whole spine. So the adrenal points that I'm going to balance are going to be the neurolymphatic and the neurovascular. And then I'm going to get help. First I'll drop it, I think, a couple of times, then I'll traction it with that anterior L5. Okay, So first, hit the adrenal reflex points, and I'm going to set the thorax as well. And then I want to see if we create a change in his leg raise just by changing his quadratus lumborum, which that doesn't mean much to you, but quadratus lumborum is that muscle on the left side. The way you were standing and before the camera, I was very much anticipating that the right quadratus lumborum was going to be a problem. It wasn't. Usually the patient takes an antalgic posture, one, to avoid pain, but two, because the muscle is failing. And in his case, the muscle was spasming unopposed, and that was what was contributing to the right antalgic posture. Even though the camera's there, I'm going to reset the adrenal point here. Tuck your chin for me, just like this. Have you ever been adjusted before? You may hear it popping. It won't be painful. I'm going to come in through here. Good. Now, let me just see if there's any change here. And there definitely is. Do you agree?
Yeah, it's not as painful, but it is painful.
Yeah, but at this point,
Yeah.
before we had you maybe here,
Yeah.
that's a nice start. That means already with what we've done, we've relieved some nerve pressure. I'm going to come in here, keep this bent to the side, hold strong and don't let me pull. Hold strong. And how much stronger is that?
A lot stronger.
That's a lot stronger. Can you look at the camera, say that real loud?
Oh, it's a lot stronger.
Okay. So that's a good starting point.
There it is. Okay. We stop for just a second.
Okay, not a big deal. Now, we're also going to make a correction in your neck. Just let this relax. And here. Now this next one is going to be somewhat surprising to you. This leg I want to bring up and out. Lock this. Push up towards the ceiling for me. Push, 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 push. I like that. That's good and strong. Bring your head this way. And extend it. Push up towards the ceiling. Okay, he shows no sign of a psoas problem on that side. Pull this knee towards your opposite shoulder. Pull hard. Hard, 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 hard. Bring this down this way. Straighten it out. Same testing position. Lock. Push towards the ceiling. That psoas is fine. Now,
It's
Like-
not saying that it's recording anymore.
The red light's on.
The red light
let me
is
see.
on.
Let me see. Recording. Right there.
Oh, okay.
Yeah, we're
There's
good.
a recording over here.
Maybe, no, okay. Well, we're good. I think we're good.
Okay.
All right, so I'm going to traction the occiput, my trusty tool. Now, I'm literally going to elongate your spine. Sometimes this hurts a disc, but the pain, if there is pain, will be sharp and temporary. Pain?
Very little.
Good. I like very little. And now, I'm going to give this a very light tug. Hurts?
No, not so much.
Hurts?
Not so much.
Not too bad. That's actually a good sign. I should have done that first. Slide down this way. I'm setting my drop. It's feeling my tension. Bend this. I'm going to tighten that up just a notch. Bend. And I'm going to get in on this tender L5. He doesn't like that. Hold this. Nope, I got to tighten that still a little bit more. Probably should have preset the drop. I'm getting underneath the abdominal muscles to get down to L5. And still I got to make it tighter. No way to make this fun. Okay, relax for a moment. And let this go. How are we?
Now it hurts.
It hurts there.
That's a lot better though.
It's definitely a lot better. We're not done with you yet. Let me see who's coming out of the restroom. Stephanie, can you send your mom back real quick? Yeah. Or Kelly, one or the other. Okay, I'm going to drop that again. We're going to do a two-person adjustment after that. we're filming. So, we're going to bend this leg. I'm going to lower the table to give Kelly a height advantage. Come on in here. What I'm going to have you do, hope your fingernails are good. Relax right through there. You got to go lower. Got to go lower.
Okay. Now you're poking my nails into them. Let me okay, wait, let me go like that.
All right. I'm going to give your leg a big jerk. Put pressure on there. Good. I'm going to do that again. Beautiful. I'm going to do that again. I could almost guarantee that if we tried to start with that, that would not have been a very good idea. How are we?
Right there.
Right there. Can you tough it out if I try to go higher? Bear with me. Bear with me. Bear with me. You may get to where it doesn't hurt. Are you okay?
It hurts a lot.
I know it does. Can you bear with me? It's not going away, is it? Okay, relax. Okay. Now, bring that up. We're okay with there, right?
It's like a nagging pain right there. Oh, that's,
But here you're okay.
yeah.
Okay, that's a nice start. Now, you're not going to like me, but I need to do this. One of the things that I've found is if you let this straight leg raise be so low for so long, the adhesions get so bad that you almost can't get out of it. I'm almost done torturing him. I'm sorry for that. Okay, now, we're good with you. Thank you so much. You can take a minute and catch your breath and try to stop sweating. What we're doing in that case, you get inflammatory process that literally ties the disc to the nerve or creates fibrous tissue around it. And the nerve won't slide very easily. And I've seen people 10 years after a disc injury where all they can lift up their leg is about that high. We want full function. We want better than he was before the injury, if possible. How are you?
Just
Need a moment yet?
all right.
Turn on your side facing this way. And I said that wrong. Turn on your side facing the other way. And he actually looks like he's moving around better on the table than we started. Do you feel like you are?
Yeah.
He's definitely moving around on the table better. Would have been a nice case to film from the time he walked in. Sorry about that. Here's one of the challenges with a side posture adjustment. I want that leg straight. Now here, this is not a posterior to anterior correction. This is honoring lateral flexion. So we have him in his antalgic posture, and all I'm going to do, relax for me, is I'm just going to drop through there. You okay with that?
Yeah.
I'm going to drop through there. Bring this down. You're going to see. Turn that up just like that. And we're going to drop through there. And I'm going to drop through there. Now, I want you to push yourself up to the seated position, from that position. And we're going to go and we're going to film the strength of that lower leg. Swing your feet up on the table again. So bend this, turn it out, just like this. Hold it. Don't let me push in. How much stronger is that?
A lot stronger.
0 to 100, 0 no change, 100 perfect. Where's it at?
98%.
98% is a huge difference. Pull back against my hand. Beautiful. Swing your feet on the floor. I want you to stand up. And I want you to walk up and down the hallway. How do you feel like you're walking?
I feel like I have more lower leg strength now.
You do. There's
still
no
a little bit of pain, but
Okay, so in terms of strength, 0 is no change, 100 is 100% better. Where's your strength?
I would give it a 90% change.
Nice.
80%,
Pain.
somewhere around that. Pain is,
0 is no change, 100 is 100% better.
I mean, it's changed. It's better. It's to the point where it's not affecting me. Like I'm very gingerly walking. It's manageable pain, but it is a difference. I would say at least a 70%.
70% reduction in pain, 90%, 80 to 90% increase in strength.
Yeah, because I
You can stand on one leg?
couldn't do that before.
Okay, yeah, you couldn't even come close to standing on one leg. So go up and down the hall again quickly, as best as you can. I don't necessarily expect you to skip, but and come on back again.
Again, there's pain, but it's a lot more manageable than before.
Yeah, lift your leg up in front of you.
The left
You can support the wall. Yeah, lift your leg up in front of you. So look at him lifting that leg. I'll get it from the side. He's standing there, lifting that leg on his own.
I mean, that's
Probably-
pain, but it's good pain. You know, I know it's pain that's helping.
Yeah, lie back on your back one
Flexibility.
more time. So, by himself, he's now got to the point where he can pick up that leg 40 degrees. So that's very nice. And, Mom, are you happy?
We won't go there.
You won't go there about
I
being
just
happy.
can't. I can see a little bit of improvement, but of course it hurts me to see him go through so much pain.
Oh, yeah.
And I just have a lot of. My job is in rehab,
Yeah.
and
Well,
so
then you'll be very helpful here.
I have seen a lot of. Have never used a chiropractor in any of my cases, and this was upon recommendation and upon seeing that he could not do anything.
Yeah.
That we came here.
Well, I'm glad
so,
to hear.
Okay, I mean that's why we're here. I'm into the orthopedist, the neurosurgeon, that sort of thing. The
Sure.
chiropractor is the last option, and I have to tell you that. So.
Well, we want to change your point of view and literally make it first option if we can. So we got a very nice gain. At least we tripled that straight leg raise, I'd say. You up for me breaking up a few more adhesions, or are you done for the day?
Let's give it a. Let me go with it on this and see if I see a difference throughout the day.
Okay.
And then I'll be willing to work with you more.
Okay, once again, your permission to share this information with doctors, students, and patients everywhere?
Yeah, that's fine.
Super. Okay, very good. Mom, who sent you in?
Henrik Olason,
Oh, yeah, the track star.
that is right.
Yeah, super.
He's my retirement planner.
Well, he's a good guy.
And so he recommended when I told him about my son's case. And like I said, I was very hesitant, but I called your office and they told me that it would be okay for you to see him. So.
Yeah. And what's your thought after one short visit?
Well, I can see a change. I can certainly see, I saw him go through a lot of pain, but I can see that he has a lot better range of motion than he had before. I'm concerned about the posturing that he's showing us,
Oh, yeah,
and
yeah.
that
I agree with
it
that.
looks very scoliotic.
Well, we
very
call
much,
it antalgic. He's leaning away from the pain.
Right, and so that gives me a lot of concern. But I can see that he could raise his leg much more. I have seen him sitting in a couch for the last month and a half and doing nothing else. He has not driven. He has not done anything except stayed in his apartment.
Well, for now, we don't want you doing much sitting. Let me ask you a question. The pain you endured during the visit, worth it so far, from what you can tell?
Well, that's why I kind of want to take from this visit and go see. That's why I'm not allowing
Yeah.
you to torque me some more. But I mean, like I said, it's a good pain. That the most pain was just when you were lifting it all the way back.
Oh, that's horrible. I understand. I haven't had that done to me because I stretched my own.
Mm-hmm.
But when you take a nerve which is tied up within the sleeve and move it, it's full-blown, horrible nerve pain.
Yeah.
But again, my rationale for that, I want you to have better range of motion than ever before you got hurt.
Right, and I mean that's just the thing, though. I know it's gonna hurt before it gets better, but as far as today goes, I'm good.
Good. All right. Well, we're all good. Thank you so much, and thank you for your wonderful comments.
And thank you.
Seven, 8, 9. There it goes.
So was that 9 or 8?
9.
Okay, 9 drops to clear.
Mm-hmm.
All right, very good.
It must have been 5 years ago since I
Okay, we're rolling. It is February 15th of 2007. The first day we saw Pat Odom was December 7th of 2006. Since that time, Pat has lost